So to kick things off, I want to introduce our first keynote, given by the wonderful Georgie Dent, CEO of The Parenthood and contributing editor of Women's Agenda. Georgie will be exploring the urgency of women's health at work against the backdrop of what has been a tumultuous 2 years.
Good morning, everyone, and thank you, Tala, for that kind introduction and also for all of the work that you have put in to make today possible. I think that the team at Women's Agenda so tirelessly advocate for a better country for women in Australia, and this is just further evidence of your commitment to improving the lives of women in Australia. And I want to say thank you for inviting me to participate today. I would like to begin by acknowledging the traditional owners of the land, and I am here in my home in Sydney on the land of the Cammeraygal people. I would like to pay my respects to their elders past, present and emerging, and acknowledge that sovereignty has never been ceded. I am on Aboriginal land. It always was and it always will be Aboriginal land. So when Tala first approached me about presenting today at a health summit, I initially assumed that Tala would want me to potentially speak about my own journey in terms of women's health. I have got a number of chronic health conditions. They are mostly invisible, but they have certainly been debilitating really since I was 19, so probably for the last close to 20 years. I guess I have had a front row seat watching how women's health conditions impact my life, impact my ability to work and the way in which I can live. I have got, like a lot of women, the conditions that I have are largely invisible. So I have a chronic illness called Crohn's disease, which is an autoimmune condition, and I had extensive and relatively severe endometriosis, was diagnosed when I was 19. Neither of these are particularly visible from the outside, but it's meant that I've spent a lot of time in doctors' offices, in hospitals, in pathology clinics, in day surgeries, and on one level, I would say that, I have almost a living PhD in managing chronic health and managing wellbeing and trying to participate in life, be a parent. I've got 3 children, be an employee, and be able to also just be an individual who can participate in life. And I have had, when I was 25, I had the unfortunate experience of not being able to participate in life because of the sort of cumulative toll that my physical and then mental health took. And I suppose because of that experience, I had 4 months where I really wasn't able to participate in life. It sort of fast-tracked my understanding that without health and without well-being, there actually isn't anything else. And I think that is something that is terrifying for women because we know that women are bearing the brunt of managing the complexities of their own lives and the people around them. So putting yourself first as a woman is something that is really difficult logistically as well as psychologically. And it's something that I understand because of the terrifying experience I had. And I know firsthand what happens if you try and put your health into a different box to the rest of your life. It doesn't work like that. Now, further to that, the fact that a lot of women don't have time to even acknowledge their health and well-being. We also know that even when women do acknowledge their health and well-being and they go to the doctor or they talk to someone about their health conditions, according to the 2021 Australia Talk survey, 1 in 3 women have had their health concerns dismissed when they've raised them. And this is almost invariably linked to the default settings in health. And we know really clearly that the default settings in health is not a woman. So Dr. Amy Vassallo, who is a research fellow at the Global Women's Health Program at the George Institute, says this: I think the general community member would be surprised to know that many of the fundamentals about what we know about human biology and functioning is based on the 70-kilo white man. That is the default human. She says that the assumption in health that the 70-kilo white man is reflective of all people has meant that's what a lot of our health and medical knowledge and research is based on. And when I read that, I couldn't help but relate to the fact that some of the more disheartening experiences I have had as a patient in the health system have been with roughly, I mean, I didn't weigh them, but roughly 70-kilo white men. I had a number of different medical professions dismiss and minimise the symptoms that I was suffering at different points. And the problem with having a medical professional dismiss or minimise your health symptoms is that you start to believe that maybe it's not serious and maybe you're being difficult. I know that I certainly had to unpick a lot of shame around that, which was really, I think as women, we are reluctant to complain. And I think that's why it is really, really toxic when you do actually complain and you're not complaining, but you outline your symptoms. To have them minimised is a really big deal. And I think when you consider that 1 in 3 women say that that's their experience, that's pretty terrifying, because that is 1 in 3 women potentially leaving a medical appointment or a health appointment, taking on the message that maybe their symptoms aren't as bad as they think, or maybe they need to just get on with things. Today, you will hear from a number of health experts with clinical and academic and scientific credentials, and they will be talking about things like the physiological health risks and realities for women in Australia. But before that kicks off, I want to use this opening session to put women's health and wellbeing at work into context, because health and wellbeing does not exist in a vacuum. We cannot neatly put women's health into a box that is different from her work or her home or her family or her financial situation. The health and wellbeing situation for women in Australia is inextricably linked with gender equity. And that was precarious even before the pandemic hit. Now, chances are you will know that women retire in Australia with, on average, half the super of men. And that's almost your best case scenario. There are lots of women who retire with absolutely no super at all, which is why we know that women over 55 are the fastest growing group of homeless people, of Australians experiencing homelessness. And they have been for the last almost 10 years. And the problem is that COVID has conspired with so many of the fault lines that have made this so and have compounded the damage. So COVID has disproportionately impacted women. It has exacerbated existing challenges and created a wider gulf of disadvantage, particularly for First Nations women, for women with disability, for LGBTIQA+, for culturally and linguistically diverse women. And over the last 2 years, we have seen a plethora of research that has highlighted the pandemic's disparate impact on women. And it does reflect decades of failings, really, in terms of not addressing the policies that have served to entrench and exacerbate gender inequity. We know that women have been adversely affected by COVID on the front line, at home, and in the economic aftermath. And all of these adverse impacts pose a risk to the health and well-being of half the population. It might sound over the top, but the cumulative impact that COVID has had actually stands to undo a generation of progress for women in the workplace. There is no vantage point from which COVID-19 is anything but devastating. But when it is viewed from the perspective of women and girls, it is unspeakably bleak. And we cannot look at women's health at work without looking at the full picture. The full picture is not pretty. So we know that almost 1 in 10 Australian women in a relationship experienced domestic violence during the coronavirus crisis. And that was the first wave. So that figure came from June 2020. At the same time, the Australian Institute of Criminology surveyed 15,000 women in Australia aged 18 years and older about their experience of domestic violence. And that research provides the most detailed information in the world about the prevalence and nature of domestic violence experienced by women during the pandemic. And that showed that 4.6% of all women who responded to the survey and 8.8% of women in a cohabiting domestic relationship experienced physical or sexual violence from a current or former partner in the 3 months prior to that survey. So that was in the 3 months from April to June last year. Many women reported that it was the first time their partner had been violent, while others said the violence was getting worse. For 33% of these women, it was the first time they experienced physical or sexual violence within their relationship. More than half of women who had experienced physical or sexual violence before February 2020 said the violence became more frequent or more severe after the pandemic started. 1 in 3 women who experienced physical or sexual violence or coercive control said that on at least one occasion, they wanted to seek advice or support, but could not because of safety reasons. ABS statistics from June this year showed that the number of police-related incidents of domestic violence and sexual assault increased by 13% in 2020. We cannot separate gendered violence from women's health and wellbeing. We cannot separate gendered violence from women at work. And what we know is that well before COVID hit, we had a crisis with gendered violence in this country, and it has worsened significantly. We all know that devastating statistic. Almost one woman every week dies at the hands of a current or former partner in Australia. And there is absolutely no doubt that gendered violence against women and children is incredibly complex. But the fact remains, we cannot address gendered violence without addressing the issues of gender equity. Because without a safety net of equity, without the ability to have secure employment or develop financial independence that gives all women, not just women experiencing violence, but that gives all women a safety net. And at the moment in Australia, women do not have that safety net. Not enough women have it. When COVID first hit, unemployment surged very quickly. And while both men and women were affected, women lost their jobs in greater numbers. In April last year, 325,000 women became unemployed, and that represented 55% of all jobs lost in Australia. Female work hours reduced by 11.5%, compared to a 7.5% reduction in male hours during the same month. In Victoria, in the second wave, in the second half of last year, women lost jobs 5 times faster than men. In New South Wales, it was double the rate at the same time. The Federal Sex Discrimination Commissioner, Kate Jenkins, warned that this was laying the groundwork for some pretty serious poverty for women. Now, the reason that a lot of women lost their jobs in faster rates than men was because they are congregated in industries hit hardest by COVID and overrepresented in casual employment. And that has constituted a pretty significant double whammy. COVID, while we have now come out of a recession, it was sort of quite aptly described as a she-cession or a pink recession because the brunt was being felt by feminized workforces. And what we know was going into the pandemic, women's employment in this country was too precarious. In February of this year, there were 140,000 Australians who weren't counted as unemployed, but they want to work. They didn't apply for a job because they cannot find suitable early childhood education and care for their children. Another 65,000 Australians in February this year said that they would like to be working, but they're not looking for employment because of their family responsibilities. We know that for women who have employment, who are lucky enough to have employment, the COVID pandemic has put so much pressure on them that they are reducing their hours and they are leaving their work in record numbers. And this is because that other very stubborn divide that we have in this country, that women disproportionately bear the burden of unpaid work, limits the capacity of women to participate in paid work. So women do 80% more unpaid work than men do. And this obviously constrains their capacity to engage in paid work. All of these structural issues have been exposed and exacerbated by COVID-19. Women at home have been dealing with unprecedented pressure, attempting to work and also supervised remote learning and also support children. We know that children experiencing distress, experiencing anxiety, experiencing sleep disruptions has been a really significant issue. And we know that it's women who have been undertaking the bulk of that work. And that's why we have seen women leaving the workforce. Even women who are lucky enough to have paid work have been leaving those jobs because it is too difficult to attempt everything that we have asked women to undertake. So there is absolutely no doubt that COVID-19 has been an absolute disaster. It is a health pandemic, but it has also created another pandemic, and it is related to women's economic insecurity in this country. And there has to be a good news component to this. And the good news story that I can sell to you is that it is time for Australia to embrace structural reform, because we are not going to meaningfully change the picture for women in this country. We're not going to change the health and wellbeing of women. We're not going to change the economic security of women. We're not going to change the divide between men and women in pay, in unpaid work, in paid work. None of that is going to be changed without pursuing structural solutions. And this is where I finally get to the good news, because gender inequity is not intractable. It is true that there is not a country in the world that has completely eliminated the gap between men and women. But it is also true that there are a lot of countries that do a far better job than Australia does in narrowing that gender gap. So the World Economic Forum undertakes or publishes a significant piece of work every year, the Global Gender Gap Report. And they started that in 2006. And when they started it in 2006, they measured the gap between men and women in countries around the world on 4 different factors. So they looked at health, they looked at economic participation, they looked at political representation, and they looked at education. And back in 2006, Australia had reason to be proud, because we had the #1 ranking for female educational attainment in the world. We were ranked 15th overall. But we have not just sort of slid backwards, we have jumped backwards. So whereas, in 2006, we had the 15th ranking, this year we're ranked 50th. We have literally gone backwards every single year since 2006. And that is because we have not pursued solutions to address gender inequity. We still have got the #1 ranking for female educational attainment. But women's workforce participation now sits at 70th in the world. And that is the most stark evidence we have that women in Australia are not able to enjoy equity because we do not enable them to participate in the workforce. We do not need women to emulate men and to have the same life as men. But if we do not give women the opportunity to participate in some form of paid work, stay connected to paid work, we are asking women to spend their lives caring, and the price we are asking them to pay at the end of that is retiring in poverty. And we know that we can change this. It takes leadership, it takes commitment. But the really good news is we have got the answers. Okay, there are things that we can do that would dramatically and meaningfully improve the safety and security of women in this country. And 2020 and 2021 have laid the groundwork and have made this more urgent than ever before, because we actually needed to address these issues before we'd even heard of COVID. Before, to quote Jackie Lambie, it was even a twinkle in a bat's eye in Wuhan. We needed to address these issues, and we didn't. And COVID has exacerbated the inequity on all fronts. And it is terrifying to think where women will be in 5 or 10 years if we don't seize this moment and actually start pursuing the structural reforms that will make a difference in their lives. If we want Australia to be a country in which women and children are able to live safely and reach their potential, we need to pursue structural solutions. 2 structural solutions that we can pursue and that I am encouraging us all to talk about. The first is to expand paid parental leave. So Australia has got one of the least adequate paid parental leave schemes in the OECD, and we also have one of the most gendered patterns of taking parental leave. So men in Australia take less than 20% of the parental leave that globally dads take. And that's not because dads in Australia aren't interested in being engaged carers. It's because our policies don't support that. Other countries addressed this 30 years ago, and they now have a far more equitable division of caring in their homes. And that equitable division of caring in their homes translates to an equitable division of paid work too. And when we support dads to be engaged carers, children prosper, the children benefit significantly from greater engagement from their fathers, but also it improves the mental health of mothers. And that is not surprising. I don't think anyone who has children or has seen a family with children, I don't think anyone would be surprised to learn that when 2 parents, where there are 2 parents, are able to equitably share that load, it is easier. The evidence shows that the positive impact on mothers' mental health is really significant. It's also really positive for fathers' mental health. So when they are able to be engaged carers at home, it's good for them. So when we talk about health and wellbeing, we have to think about the big picture. And reforming paid parental leave is one of the policies that it's a rare policy in that it directly influences behaviour in our homes. And it's a longer term solution as well, because the caring pattern that is established in the first year of a child's life persists over the course of that child's life. So if we have a situation where we're asking dads to take just 2 weeks or less than 2 weeks of parental leave when a baby is born, and mum is going to take a year, that will be the division of responsibility largely over the course of each child's life. And that makes it very clear why women do not have the same capacity as men at the moment to participate in paid work, to stay connected to paid work. And that is directly linked to their well-being and their health, because not being able to be financially secure is detrimental to women's health. The other structural solution that we desperately need is universal access to high quality early childhood education and care for every child and every family who needs it. We have got some of the most expensive out-of-pocket fees for childcare in the world. We have got participation rates of 3 and 4-year-olds that lag the developed world. We have got 1 in 5 children arriving at school developmentally vulnerable, and those children rarely, if ever, catch up. And the silver bullet we have that we know will not just set children up for lifelong success and lifelong health, social, economic and educational benefits, but it also gives their parents the ability to provide for them. it is particularly linked to women's workforce participation, because the high cost of care constitutes a very significant barrier for women participating in the paid workforce. So my ask for you today is, if you are interested, and I know you're interested because you're attending here, if you are interested in boosting the health and well-being of women, I would ask you to be engaged in improving the big picture for women in this country. We will have a federal election in 2022, and it is an election where we have to put gender equity on the map. It has to be an election deciding issue. And that is one thing that we can all participate in and we can all do. And if we do that, we will be able to dramatically improve the health and well-being of women in this country.